Welcome back again. Another question that we're going to answer here. This is another common important issue that we see sometimes. So this gentleman is saying that he had an FUE procedure about a year ago, and whether this is a failed procedure or not. Here's the picture that he sent. So he goes into a little bit more detail that he talked to his surgeon, and the surgeon said, or his provider, I don't know, and the surgeon said that it was good results, there was nothing wrong with the results. So he's upset, the patient is upset. A couple of things could be happening here. So one thing that's very important, and I think that's probably a part of this, even if it's not the whole thing, it's important that when you go for a consultation for your hair loss, that you see the actual surgeon that's going to do your surgery, okay? I see many patients out there that come to me and they had a transplant or had a consultation, never saw the doctor. And why is that important? Number one, because me as your physician, as your surgeon, I need to evaluate your scalp. I need to see what I need to do for you. I need to see what I can do for you, right? And if that's the case that we recommend a transplant, I need to tell you what you should realistically expect from the surgery. That's my job, is to provide that information to you. And so a lot of times what happens is a mismatch between expectation of the patient and what the doctor knew in his mind that he could create. So if that's not addressed in the consultation, then at the end of the day, you may have a good surgery and a good result, but if it's not what you expected, if it's below what you're thinking, then you're not going to be happy, right? And so to solve that problem is in the consultation. When I see a patient for consultation, I spend a lot of time with them. I make sure that I try to inform them very well what I can do with the area that he has, with the hair that he or she has to do, and all these factors. Sometimes it will take 2 surgeries to achieve your results, and if I don't tell you that, then you don't know. But it's my job. That's why I am spending time with you to tell you, okay, to achieve what you're looking for, we will need 2 procedures. That way you're aware of it and it's not going to come as a surprise later. So again, that's part of the consultation that we do every day. That's why I see every patient personally for consultations, right? Another thing that can happen, and I don't know how many hairs or how many grafts he had done in these areas. Sometimes there's poor growth because nowadays there's a tendency of doing hyperdensity in the hairline or in zones like that. So in a small area, these surgeons are putting thousands of grafts. I don't like to do that for this reason. Sometimes you try to pack them too tight, too close together, and this is not new information. It's been around for a long time. We know it. The more you pack, the more you have a chance of having hairs not grow. And so maybe that's what happened here to some degree. Again, I don't know, so I'm not going to speculate on that, but that's a problem. That could be an issue too. What I see here looking at the pictures is that he's pulling the hair back, so it's a little bit hard to evaluate. I know there's grafts here because I know what to look for, right? I've been doing this for a long time, so I have a clinical eye for it. Basically, in my mind, he needs more hair. Whether that was already expected or not, again, it goes back to the beginning. That should have been discussed in the consultation. Second surgery will be needed for extra density. If that was done, then he wouldn't be upset now, more than likely. He would be already looking forward to the next one, and the relationship would be preserved with the surgeon. So again, that's why it's so important to consult with patients or people with experience that are actually able to see you. If I don't give you the time of day to see you during your consultation, how can I expect to earn your trust, right? So it's very important that I'm there for you, and so make sure that when you go for a consultation that you're seeing the actual surgeon and asking these questions, okay? So if I can be of any help, I'm here. Just give me a call. I'll see you next time.